Welcome to Let's Talk Health, and this is our very first podcast, and we are excited and glad that you have decided to join us. We are your host. I am Casey Ricks.
And I'm Dr. Shannon Ricks, family nurse practitioner.
And we're definitely, as I said before, glad that you decided to join us. So, babe, how are you doing? How is work going?
I'm staying afloat. I'm making it happen.
Well, I definitely miss you here. I'll be glad to see you again when you get here. So why are we doing this? What made us want to start a podcast talking about health? Our reason, for those that don't know, our reason for starting Let's Talk Health is to deal with the health issues that are plaguing the Black and Brown families and communities. And our goal is simply this: to empower, to transform, and to educate families on those health issues that we deal with in the Black families and in the Black communities on a daily basis.
That's right. Today, our topic is one of great interest to me. It's socioeconomic disadvantages in the healthcare system. And our guest speaker is Dr. Jasel Martin. Welcome, Dr. Martin. Can you introduce yourself to our guests and our audience?
Yes, thank you, Shannon, Dr. Shannon, and Pastor Casey for having me on your show.
Yes.
First of all, I think it is incredible to see husbands and wives work together, especially to address issues like this. So thank you very much.
Amen.
Out into the community. So just a little bit about me. I went to Oakwood University, where I graduated with a
OU.
OU. I graduated with a bachelor's in biology with a minor in chemistry. Went on to do a master's in business administration, in healthcare administration. So I've worked as a hospital administrator for quite a few years, which kind of influenced my decision to transition into public health, which was kind of a natural, gradual thing. Honestly, I didn't have a plan. I originally planned to go to dental school after Oakwood, which I did. I went to Baylor for a year and absolutely detested dentistry. I'm sorry to the dentist out there, but it just wasn't for me. The oral cavity was not for me. And so did my MBA, worked in that for a few years, and I started to see some disparities in the healthcare system and just how it was run. I became really just disgusted with how it was run, to be quite honest with you. There are several days where I came home crying because I was just like, these are human beings. I don't understand why we're doing this. It was just so unethical. And so I decided to completely change scripts. And that's like, instead of meeting people at the end of their condition, I want to be on the education side and help people not become sick at all. That was my goal. So I ended up being able to go and do a master's in exercise physiology at Georgia State University. Through that, had several great opportunities, did my clinical training at Emory. I worked at the CDC doing physical activity research, as well as a lifestyle specialist. From there, I moved on to become the director of exercise science at Andrews University. And so worked in the Department of Health Services and the Department of Public Health up there. And then decided, you know what, this is great. Well, also in that time, I did my doctorate in public health at Loma Linda University as well. So yes, I've been through to pretty much all of the Adventist schools in this country. And so from there, I decided, you know what, there's more to this. I felt like I was hitting a glass ceiling in my career. So I decided to get more into health services and the population health side of things. So I moved to Baltimore to do patient-centered outcomes research, primarily with medical and pharmaceutical interventions. which we could talk about in another time. But that is how I got into healthcare quality and the policy aspect of things. And so now I am a Medicaid executive in Washington, D.C., as well as a professor at the George Washington University in D.C. as well. So
awesome.
Happy to be here. And thanks again for having me.
All right. I'm definitely glad that you came to be a part of it.
Yeah, so we're going to jump right in. So many people don't know the difference between socioeconomics and social determinants of health. Okay. So can you explain, the domains or the differences between the two?
Sure. They are indeed quite different, even though they are related. Mm-hmm. So health outcomes that we are interested in, especially yourself being a clinician, they are largely influenced by social economic factors. And these conditions usually fall within 5 major categories. So that's usually genetics, you have your behavioral aspects, your environmental aspects, as well as the physical influence that also goes with that. You have the medical care and all of the factors around medical care, and then social factors. And so this social factor category is what the social determinants of health are. So they're essentially a component within social economic factors. So they're not exactly the same. And the social, or we call them SDOHs for short. So if I say that, that's what I mean. Mm-hmm. Social determinants are a combination of both economic and social conditions. And they're determined, hence the word determinant, by an individual's resources, how much power or influence they have, how much money they have, how much education, what their occupation is. All of that stuff is what influences someone's socioeconomic position. I can go deeper into that if you want, but essentially those are the differences. And so like an example might be someone's ability to not only get a job, but to keep a job. Do they have the resources that are needed to keep the job, like transportation or access to certain resources, or just the ability to pay their rent or find a place to live? Those things all impact your ability to keep your job. Living conditions. So, and then all of these, if you look at them in an isolated perspective, they all directly connect to health equity. And health equity is basically someone's opportunity to fulfill their health potential. And that is what we're seeing is the disparities across the country, is people aren't given the resources to attain their full potential. And so I like to use an example with my students. I am a former track and field athlete, so I use a lot of track analogies. So you think about a track, it has 400 meters around, right?
Yeah.
So it's broken into 4 different segments. If you have someone starting at the very starting line, and then you have someone else who's starting at the 200 meter line, which is half the distance, right? Close to get to the finish line. But you expect both people to cross the finish line. Is that a fair fight? That's not fair. There's just not. So then when people start saying, oh, we'll introduce equality into it, right? So if things are equal, that means that both people would have the same advantage. So let's just say we give them both a 100 meter advantage. So now the first person, instead of starting at the starting line, they're now starting at the 200 meter line. And the second person is starting at the 300 meter line. But that person still has an unfair advantage. They still have it. So that's why we have to introduce the concept of equity into the equation, because that gives the person starting from the starting line the exact same advantage to reach their maximum potential as the person starting at the 200 meter line. And so
I'm sorry, you can go ahead.
Oh, it's okay. No, go ahead. What's your question?
So when you say equity, can you explain kind of what that looks like? When you say giving people equity to do that?
Okay, so I'll take employment, for instance, or forget that. We're all college graduates here. Let's let's talk about the inequities as it pertains to starting from scratch. So once you graduate from undergrad. So the average Black American, and I say Black instead of African American because you're also considering people who are Caribbean American, those who are actually from Africa who have migrated to America. So Black Americans on average have around $8,000 in student loan debt, whereas their white counterparts only have 2 to 3 on average. 4 years after that, they have around $53,000 in student loan debt because of the interest rates and all the other stuff. And they might have gone to grad school. So now they have $53,000, whereas after 4 years, their white counterparts only have $21,000. That's less than half of the same amount of debt. So from the gate, you're starting your adult life at a greater disadvantage because you already have all this debt that you have to pay back. And then don't talk about going to do an advanced degree or something like that. You're adding an extra 100,000 plus onto that. So that is what I say. That's what I mean when I say equity. So if we're going to make things equal, like for real equal, people should be at the same starting place in life. So whether it's their education, whether it's their finances, whether it's their debt. So I'll use a real world example. So in DC, you have Southeast DC, for instance, which is across the Anacostia River. It is a food desert. It's a medical desert. It's an everything desert, basically. There's nothing there. There's high crime. There are different initiatives that are going on there, which amen to our DC coalitions and partners. So I'm very proud of you guys. Thank you for the work that you're doing. However, if we really wanted to make things equitable, if we're talking about programs that are going to help someone get to healthy food, it's also going to include transportation. It's also going to include bus fare. It's going to include different things than someone who lives right up the street from Whole Foods or wherever we're giving vouchers to. It might also increase, you also might have increased dollar amounts for the vouchers simply because of the fact that they have to commute and they have to bring the things back. You should also include the size of their families. They might have to buy more food for more people, so the vouchers wouldn't exactly be the exact same size. So it's more so about making our interventions and our programs tailored to an individual's needs to make sure they have every single resource they need to have the outcome that's desired.
Makes sense. So I think you may have hit on this next question, but if you can go more in depth on it, how do socioeconomic factors impact health?
Ooh. How much time do we have?
Well, here's a clue, maybe a point to start, like neighborhood, socioeconomic status, kind of what you talked about.
You said something that I was gonna wait to bring it up, but you hit on something that I wanted you to go more into. But I'll go ahead and start.
Okay. Well, I'll keep it kind of broad, and then you can help me hone it down as specific as you want. So social determinants of health, such as poverty, unequal access to health. So you have healthcare and health status disparities, which I'll get to in a second. You have lack of education. You have stigma even. So a lot of people who have Medicaid, there's a stigma that, if you're on Medicaid, you're poor, you won't work, you don't find a work.
Exactly.
You just... Yeah, that's so not the case in most situations. Then you have the racism, and these are all underlying contributing factors to health inequities, which is why we see such huge disparities in both healthcare and health status. So just to break it down for the listeners just a little bit more, healthcare disparities look at ways different populations interact within the healthcare system. So, for instance, do vulnerable populations have equal access to services? Or are there disparities in the quality of the services that they receive? Looking at utilization rates and how they differ within different populations. Those are healthcare disparities. And then there's health status disparities. So we should be very specific when we're differentiating between the two. So health status disparities are more about how do mortality and morbidity rates differ between different populations.
Okay.
And how do these rates of certain diseases differ between different populations? So that's when you're starting to look at whites versus blacks, whites versus Hispanics. Whites are always the reference group because they carry the least disparities in pretty much all of this stuff. So that's why it's that way. So not to make it seem like I'm just picking on one particular group of individuals, that's just how the research is, because we're looking at the different groups. And so when you start breaking down these health status disparities and comparing them to the social determinants, they're directly correlated. So yes, if you have a high level of violence, or you have housing instability, or you don't have easy access to care, your health disparity, your health outcomes are going to be far lower than if you had access, appropriate access to all of these other things, or you just didn't have them present in your life at all. So it's a direct correlation to poor health. That's just the way it is.
Yeah. And so with neighborhoods that people live in, how does that impact the health part of it?
Yes. So when you asked me that question, the very first neighborhood that popped in my head was the south side of Chicago. There's a humongous landfill over on the south side. I can't remember what city it's in, but it's around a predominantly Black community. And many cities have this same issue. Even when I lived in Atlanta, when I was in grad school, one of my research projects was looking at the air quality in different neighborhoods. And so I tested the air quality along, are you guys familiar with Atlanta?
Yeah.
So along I-20 in the West End area, there's several houses that are very, very close to the freeway. And so we tested the air inside and outside of the homes. And the level of particulate matter is very small particles. And we were particularly looking at particulate matter that were smaller than 3.5 microns, because that means that it could get down into the alveoli of your lungs. And you can, you're breathing this toxicity. And so we found that homes that were typically Black and brown were typically closer to landfills, not landfills, even though they are technically fields of trash. They're also very close to very busy streets, very, very populated streets or highways. So they have high levels of particulate matter. They're typically older, so they might not have windows that are actually going to be double paned and block out the pollution coming into the homes. And therefore, you also have kids who have higher levels of asthma, you have higher levels of COPD, all of these other chronic illnesses that are directly related to their environment. So there's a very clear relationship between where you live and your health outcomes.
And so it's not just about the poor. Middle class can be affected by it as well, is what you're saying.
Oh, yes.
Because a lot of times when we talk about the socioeconomic, people mind automatically go to the poor, you know what I'm saying? Because that's how we think. So you're saying it can affect the middle class as well.
It absolutely can. That location is also something that we should consider when we talk about social determinants, because even if you look at urban versus rural, or even different parts, so you have certain parts of DC, for instance, and I use that because I live in the area, but you have certain parts of DC that are much more populated than others. And people your housing looks different, the age of your home looks different. So location does play a part. And if you are not just completely affluent where, there's an old window, let me just go take care of that. This impacts you too. It impacts all of us. Yeah. So,
and that puts us in our next question, which is how does the one socioeconomic and status and the environment that they live in impact their health, and you hit on that. But can you go a little bit more deeper in that, how it impacts the environment, if impacts their health?
Sure. Yeah, I mean, you have exposure to all kinds of damaging agents in your environment are going to hinder you just from having good health. So this could include lead or asbestos or carbon dioxide or excessive industrial waste, similar to what I was saying about these landfills. And it varies with social economic status. So yes, middle class might not be as affected, but they are affected. And that's just the case. So the lower the SES typically, or social economic status, SES, the more likely it is that you're going to live in and work in a worse physical environment, which that's
sad.
Really sad that we could even make that correlation, that the poorer that you are, the more exposed you also are. I mean, even look at COVID and what's happening around us. And most of the essential workers outside of healthcare, they are low income individuals. They're the ones they don't make that much money. They're mostly Black and brown. They're the ones that are always the most exposed to everything. And this is no different from any other situation that we've observed in society. So, you have poorer neighborhoods who are disproportionately along highways, like I said. And they're also, when it comes to community cleanup, the most vulnerable communities are also not really visible. They're not the ones that are targeted for these community cleanup projects either. So it's like, okay, you guys are going into the community and you're doing something, but you're not reaching where it's hardest hit. So I'm not even going to go down that rabbit hole because I won't get back. But there's housing quality as well. And then also, I meant to say lower SES individuals also experience greater residential crowding and noise as well, not just exposure to toxins as far as, the air quality and stuff like that. Because think about it. If you live in the projects, there you have way more neighbors and a much smaller span of space. Those housing conditions are not up to code a lot of times. You might have mice, other infestations, mold, old paint that has lead in it. There's so many different things. One of my favorite shows, I talk about this show all the time, people probably get tired of me talking about it, is, not just The Good Doctor, but it's blanking. I'm blanking. What is the name of this? It's in New York. Why I am legit blanking on the name of the show right now. I don't know why.
It'll come to you. It happens to me all the time.
But on one episode in particular, no, for real, this is bothering me that I can't remember because we're on break right now. So it's not, I don't want you to repeat. But it's New Amsterdam. Anyway.
Oh, that's a new one, yeah.
Yeah. So it was designed to kind of mimic some of the stories from Bellevue Hospital. But on one episode of New Amsterdam, there was this young boy who had really chronic asthma. He had a whole bunch of different things, and they couldn't figure out where it was coming from. And so they traced it back. One of the physicians went to the boy's home, and they ended up having the house tested for lead. There's no lead in the paint there. So they're trying to figure out his symptoms are consistent with lead poisoning. However, his home doesn't have it. It turns out that they lived under a huge bridge, and the bridge had lead in the paint, and it needed to be completely redone. And so all this goes back to say that it might not even necessarily be in the home. Sometimes these communities, like I know we'll talk about Flint, but you talk about cities like Flint and the infrastructure there and how it's just forgotten and it's not kept up. It also impacts the exposure that people have, especially those who are on the lower income bracket of society.
Yeah. And since you brought up Flint, Michigan, and everyone should know by now about Flint, Michigan, and the lead situation over there, as well as the COVID-19 that's going on right now. Can you explain how socioeconomic impact those two situations, Flint, Michigan, and COVID-19?
Sure. So I guess I'll start with COVID first, since that's what we're kind of experiencing right now. But COVID is highlighting a series of injustices in our nation. There's so many different things that have come out during this time, from the racism to the intrinsic and extrinsic bias. And what people need to understand is that the system is not broken. It is really working very well. It's working the way that it was intended to work. And I wish people would say, the system's broken. No, the system's not broken. Trust me, if it was, they would have tried to fix it by now. Yeah. It's us trying to break it and restructure it. That's why things are not moving in the direction that we need it to as quickly as we need it to. So anyway, I don't want to get into a whole political type of thing right now, but it is just what it is. So the people who once denied the severity of how inequities and inequalities impact communities of color are being forced to acknowledge the disparity. So, we talked a little bit about that offline, but that's one of the perks. I hate to say perks because it's been such a painful and horrific time for so many people. This is one of the positive outcomes, I'll say, of COVID. However, we have a very strong evidence of a history of situational, institutional, systemic racism in this country. And that is very evident in situations like Flint. And what people don't even really know, people don't really talk about anymore, is that that's not the first time we've seen instances of environmental racism in this country. If you think back before, I can't remember what year it was, but Niagara Falls, New York, in the Love Canal situation, that was an environmental injustice, specifically around water. There was also the DC health crisis in the early 2000s, also involving water. And it came back to this whole conversation around the infrastructure, right? And it makes you wonder, like, is it borderline genocidal for you to completely ignore communities of color and their needs and the structure of and the integrity of things like their water, their homes, and different things like that? So these people don't really talk about environmental racism, but Flint is a perfect example of that. And I know that the governor says that he didn't know. Really, dude? Okay. Come on. And honestly, I lived in Michigan during this time, and Berrien Springs is not very far from Flint. So it was a very terrifying experience for all of the residents of the state. But I can't even imagine being a parent who lost a child or had a child become ill from someone else's negligence and purposeful negligence as well. So, these types of events have ramifications for everyone. And it's not just enough for us to depend on the government to take care of us. We have to be involved and proactive and be vocal and make sure that stuff like this is taken care of. So when it comes to COVID, when it comes to Flint and any other type of environmental thing out there, I say that we need to make sure that we have the education around this stuff, because it's not even just a race issue at this point. It's a data issue. The data from the disparities, it highlights all of these pre-existing issues surrounding social determinants of health and health disparities. And so again, the education, it comes back, and I'm not saying education like formal education in a school. I mean things like what we're doing now, having these crucial conversations with the community so that way they are aware. We need to also make sure that people understand the implications of financial health and how it's related to physical health, how we can reduce our death rate, because right now our death rate is 2.5 times higher than someone who hasn't, or for people who haven't finished a school, it's 2.5 times higher than someone who has finished and gone to college. There's the food deserts, and there's redlining, and there's poor public policies, there's lack of access. These are things that we have to make sure happen, so that way these disparities that we're observing during COVID and what's happened in Flint just do not continue to cyclically happen, which has been the case. It's all of that compiled. I mean, and I'm just getting into like the tip of the iceberg. There's so many deeper underlying issues, but we have to make sure that we are educated and start to really change the game. Because if something else, and what bothers me is that when the Obama administration left office, they specifically said to the Trump administration that they needed to get their whole emergency disaster response system up to par. They made it very clear, this is not going to happen. And the next major influenza outbreak is going to cripple our country. And this happened, 5 years ago? And here we are. So many lives could have been saved. And it just, the trauma that this has had on the Black community, I don't even have words to describe how appalling it is. I mean, because what we did not do is prepare to address our most vulnerable populations. The people who already have chronic illnesses such as diabetes and hypertension and arrhythmias, and people who smoke and have CVD, cardiovascular disease. All of these populations are the most targeted. And because we didn't understand the virus, but we also didn't do our due diligence. And it's a blatant example of neglect. Flint is a blatant example of neglect. That's the point that I'm trying to get to. And so that is how they're both related. We have to do better positioning ourselves so that way neglect is not a factor anymore and this stuff just stops happening.
Yeah. And I appreciate that. I definitely appreciate you for clearing that up because a lot of times, as I said before, we don't realize that it impacts us, those of us in the middle class. It's not just a poor thing. It can impact anyone. So we're going to go a little further and discuss a different part of this, incarceration. What impact does incarceration have on socioeconomics in healthcare?
Yes.
Oh boy. It's really interesting that when you start talking about incarceration, they only talk about I dare not call them prisoners because everyone who is incarcerated does not deserve to be there, and they should not be. They shouldn't have that title. So I'm very careful about the labels that we give to people. But some people who have been incarcerated, there are also critical things that happen to their families as well. So it was interesting because I read a study on this several years ago where it was discussing that it's not necessarily the length of the sentence that has the most impact on the health outcome. It is the fact that the person was incarcerated at all. It's just that traumatizing, whether they're there for a month or whether they're there for 15 years.
Yeah.
And so I think that is if that alone does not make us give us the ammunition to want to change and reform our legal justice system. I mean, because that alone is shortening so many people's lives. It's not even just the fact that if you've been incarcerated, you have higher chronic illnesses. It's none of that. It's just the fact that simply because you've been there, you have a higher it's like you just shaved years off your life simply because you were behind bars. Which says so much. And I mean, I'll probably talk about the Reconstruction Acts and some part of our conversation today. And, you know, the amendments to the Constitution, primarily the 13th and 14th Amendment. The 13th Amendment is the one that people say eradicated slavery, right?
Mm-hmm.
Didn't eradicate slavery. It simply changed the form and the name of slavery and what was legal in this country. And so that, I think that there's something very powerful about that, because we haven't seen any changes in what happens to someone health-wise and mental health-wise, especially after incarceration, as we did from slavery. Like, it's the same type of residual effects that happens after someone comes out of prison. And I mean, you start thinking about from even an emotional level. We don't really delve into all of the other areas of health all the time. We just talk about physical areas. So if it's cardiovascular disease or diabetes or something, those things get all the attention. But we don't talk about the fact of the suicide that happens afterwards, after people are released, or the fact that so many people, the recidivism rates are so high because when people actually do come back into society, they can't find a place to live. Sometimes their families have disowned them. They can't get a job. So what do? They do something to go back to prison, because at least they get food, healthcare, and shelter.
Get things that they need to survive.
Things they need to survive, basic necessities. So, I mean, and if you even think about the penal system and how it has grown since the 1970s, it's so crazy that in nearly 4 decades, I mean, the prison rate our population has grown almost 5-fold in 40 years. And so you have that many more Americans who also have these health issues once they come out, or even while they're still in. And the fact of the matter is, people don't realize our taxes go to pay for the healthcare system of those who are institutionalized, whether they are in prison, whether they are in some type of mental institution or hospitals or anything like that. Parts of our taxes go to pay for this stuff. So it is in our best interest to also care, even if you're not like, oh, well, it's my fellow Black man or woman that's experiencing this. That also plays a part as well. So within that, like, you have the families. I touched on the families a little bit, but I thought it was really interesting that the daughters of men who are incarcerated have higher BMIs or body mass index. They are more exposed to also being incarcerated. They have higher levels of cardiovascular disease and underlying stress, as well as a bunch of other psychological issues that develop from that, from their father being taken, the relationship between a father and a daughter. Whereas the young man doesn't necessarily have all of these bodily changes that happen or that are predisposed to, but they are 4 times more likely to also be incarcerated than someone who doesn't have a parent who's been incarcerated. And they are also more, the spouse or the significant other is also more inclined to have a heart attack, stroke, suffer from obesity, pretty much all of the lifestyle conditions that we observe, and they're all directly related to stress. So the point is, everything that you can possibly experience from a stressful, traumatic situation is what happens after incarceration of a family member or a loved one. So it's deeper than what we think.
So it's like a domino effect. Wow.
It is.
Wow.
And it has generational consequences. That's the biggest thing. It's not just your family here and now. This is like 4 and 5 generations down the line that it impacts.
Yeah. Wow. So in 2009, 2010, somewhere around there, the greatest president of our lifetime passed the healthcare law. Some call it Obamacare, but others call it Affordable Care Act. How has the Affordable Care Act, how has Obamacare impacted healthcare disparities?
I laugh every single time someone says Obamacare. I don't know if you guys remember, but when the ACA was first getting, the news was talking about it, people just didn't understand what was going on. People were like, well, what do you think about the Obamacare? Oh, I hate it.
Yep.
Blah, blah, blah.
Yep.
It's just this and this and this. And then,
Yep.
the exact same people. Well, what do you think about the Affordable Care Act? Oh, it's great. I don't have
Yep.
to suffer from my pre-existing conditions anymore. I don't have a lifetime maximum. It's the same exact thing. It's simply, again, goes back to that underlying bias that we all have them. Let me be very, very clear. We all have biases, every single human being. But it is up to us. What differentiates, I have my students go through an exercise because I ask them, what is the difference between bias and racism? People use them interchangeably. The difference is if you recognize your biases and you work to address them and you don't let that translate into how you treat other people, you can work on it. Yeah. But if you blatantly maximize and heighten that bias to the point where you are doing harm to other people, that's when it becomes acts of racism. And that's not necessarily calling people out their name or using inappropriate slur words or anything. There are microaggressions also that are also racism. Yeah. So anyway, whole other topic for another day, but I really love talking about that. But because in insurability or uninsurability and access to care were the most predominantly drivers for poor health conditions in this country, the ACA was established. Those are the primary reasons why Obama and his administrators and staffers were so adamant about getting this done. And when you understand the history of health reform in this country, you understand just how monumentous this was, because so many presidents have tried to address healthcare. You can go back past Truman, all the way back to the 1930s. Every single president tried to address healthcare and failed. And while the ACA is not perfect by any stretch of the imagination, it is amazing. It's a miracle that he was able to get it passed. Yeah. And so I don't think people understand. First of all, they don't understand the history. Because if they did, they'd be like, you know what? You go, boy, because that was hard. But being able to address these, and even within that, so you have 10 different core components that are supposed to be addressed in a healthcare or health insurance policy, right? So expanding that and having more of the preventive health measures included in managed care, like Medicaid, Medicare, where people, they not only get the care, but they get access to ancillary resources that are also going to help with their health status. So let's take maternal health, for instance. So it's not just making sure you get to all of your appointments on time and that women are actually in care when they get pregnant and not in their second trimester, which is what we commonly see. A lot of women go their entire first trimester without seeing a physician or seeing a health practitioner. And that's very bad because we could catch so many things in that first trimester if they were simply in care. So we're not only addressing things like that, we're also making sure that, hey, do you have diapers for your baby when your baby comes? Do you have the resources? Are you in stable housing? All of these different factors, these SES factors that we've been talking about, they play a part. And the ACA was directly related to making sure that those services were a normal part of business and not just some, a nonprofit or some other organization doing a one-off service that might or may not be sustainable for the long term. These are now things that are embedded in how we do business. And that I think there's so much power to that because the ACA was able to bring these social determinants and start to enact them and make them operationalized, for lack of a better word, instead of just some vague concepts. Mm-hmm. And so that is another really, really important thing that I don't think people are really highlighting. And it also helped bring attention to several populations who were the most impacted, such as Black Americans, American Indians, Alaska Natives, Hispanic Americans. These are the populations that were most greatly suffering, and so there are policies and procedures now that directly benefit these populations, so they're not as forgotten. Don't get me wrong; these things are not where they should be, but
yeah,
it's an effort in the right direction.
Okay, good.
The way of summarizing, it's an effort in the right direction. Still has work, but it's in the right direction. I like that. So you talked a little bit about data, and I know you have a strong research background, so we're going to go into this area a little bit more. So I've read some different research articles, and some of the research has stated that social determinants explain the racial inequity, which we brought up that word before as well, as the result of social institutions that systematically disadvantage minorities. Can you kind of delve more into why social exclusion from economic participation and power is a major vehicle for institutionalized racism in the United States? And the reason why I'm bringing that up, because I think that's going to be one of the major areas that we can pivot to beyond the conversation, is that social exclusion from economic participation and power. Can you just talk about that a little bit further?
This is a very compound, complicated question, but I will do my best to summarize it in a way that does not take forever. I mean, I really love the quote that Martin Luther King gave. I mean, he's given so many of them, right? But there's one where he said that racism still occupies the throne of this nation. Mm-hmm. And I love to be commenting on this when the statement is no longer true. However, racism, I mean, because it's ever changing, I doubt that it will fully ever go away, to be honest with you, especially being the way that this country was set up. There is structural racialization, which is a system of social structures that reproduces cumulative and long-standing racial inequities in this country, which is a huge, I mean, I'm going to get deeper into this, but it's a huge reason as to why most power, social power, has not been given to minorities in this country, simply because of that. And so, like, if we go back to thinking about when Obama left office, and people would use this phrase, post-racial society, they acted like just because we had one elected president who was Black, that racism just went away. And that power to Black people was, oh yeah, okay, well this shows that, yeah, Black people have power. That's not true, because we've had Black elected officials long before. I'm not taking away what happened to President Obama. However, we've had many elected Black officials for decades. We've had police chiefs and mayors and council presidents and governors even. And so, and those hardly even made a change in economic conditions, where we find low and moderate income communities of color. So race is deeply embedded in our society. I don't care what anybody says. If you can be a minority in this country for one day and tell me that that's not true, that wouldn't happen. And at the same time, social understandings and implications of race change over time, and how that is, how that plays a part. I know people say, oh, race is a social construct, but is it though? I mean, in America, it's a little bit more than that. I think we're discrediting the impact that it's had. And you can see like different key moments throughout US history where race played a central role in shaping economic and social practices. For instance, Bacon's Rebellion. People might forget about that. I think we learned it like in grade school. But this is where poor whites and blacks joined together to gain more economic control. You had the annexation of Texas and the Southwest Territories of California. Mexicans who remained in and around the annexed territories were granted US citizenship, but were not treated the same as the white settlers from the East. And so what happened? They were just like, we want to be treated equally. And even that, something that happened that far back, this was in, I don't forget the year, it was in the 1800s sometime, but this still plays a huge role on the stage for today's immigration policies, which is why we have conversations about building stupid walls, which, come on, I mean, I'm not going to go there, but these things haven't changed. These policies haven't changed, and they're deeply integrated into our society. Like even, I know so many people who have served this country and they're GIs, and they talk about their GI Bill, but what people don't talk about is the New Deal, which is associated with the GI Bill. And so that again, it's a concept of racialization, because what it laid the groundwork for was modern day gentrification. Mm-hmm. And so my question with gentrification is, I'm not opposed to fixing up communities, but my question is, why can't we eat, play, work all together? Why do you have to displace the people who are already there?
Yeah,
exactly. If you're going to go into a community and fix it up, but don't change the demographic of who lives there. Don't make people's homes that they've lived in generationally for 200 years and make it so expensive where they can't afford their own mortgage anymore.
Right.
That to me is, I mean, it's not even just to me, but that is racialization. And that is what the New Deal essentially created over time. So anyway, so back to your initial question. I mean, because again, this is a very, very deep conversation. It's literally something I could do an entire class lecture on this, but we need to focus on racial justice policy development. We've seen that racialization runs through all of our social systems. It is very, very systemic. It runs through every single aspect of society, and it's very intertwined with economics and also with political power. So that is why a lot of times people just can't seem to mobilize and get past their own current economic status, because it was designed that way. I'm not condoning it, I'm just explaining it. And so we have to have a very clear vision for a better society, a racially just society. And so we need to take this history, and we need to take the systems that are that have been implemented into question, so that we are literally picking it apart, because there are disparities in income, there are disparities in education, there's disparities in healthcare between the minorities and the whites, and these are all symptoms of structural racism. So they're going to lead to higher rates of incarceration that you asked me about. They're going to lead to a lack of accumulated wealth and lower life expectancy. And that is how we're going to fight. We have to be very systematic and strategic in how we approach this, but we have to have that data to validate what it is. Because like I tell my students, the numbers speak for itself. We could go in there and tell our stories. There's a lot of power in qualitative research. I consider myself, well, I don't just consider myself, I am a mixed methodologist, so I use both the numbers and the stories to help tell the whole story. So there is power in our stories, but honestly, to the people who have the power, they care about the numbers, they care about the money, and they care about the numbers. So that those numbers, that data, is what's going to be absolutely pivotal to addressing this issue.